I think we've got lots of people joining us, so I'm just going to get started and welcome you to the second breakout session of the conference today. So we're here today to share the collective learning about how the 5 A Better Start partnerships are supporting change collectively through the element of services. So I'm Melanie and I'm from the Blackpool Better Start partnership, and I'm leading this session with my colleague Catherine, and we are joined by colleagues from the other partnerships. That's Alison, Carla, Helen and Nikki. And you can see our roles and pictures of ourselves and also which site we're from on the slide here. So there was a quote I heard recently that said, real change begins with the simple act of people talking about what they care about. And that's certainly true. And we're going to do some of that today. And Elliot said earlier in the introduction session with the directors that change has to start with us. So let's think about that as we go through this session. So we're going to start by sharing about the common approaches from across all of the 5 A Better Start partnerships. And then we're going to be showcasing some of our work here in Blackpool with a more of an in-depth example. And then moving on, Alison, Carla, Helen and Nikki will share shorter examples to bring their work to life from their areas of Nottingham, Lambeth, Bradford and Southend. So also the most exciting part, there's going to be opportunity for everyone who's joined us in this breakout session. We'll open the floor up to questions, but that'll be through the chat functionality, and that hopefully will prompt further discussion. And that should happen around 12:20. So if you wait till around that time to pop your questions so they don't get lost in the chat, and if you know who your question is for or which partnership site it's for, then pop that in as well. And we will be able to open that discussion up. So, as we heard earlier this morning, A Better Start partnerships are doing things differently, but what we're doing is always doing things differently together. And the collective aim is about improving outcomes and giving babies the best start in life. So through working differently, this means we can have the greatest impact for babies and young children's lives, both now and in the future. But what are some of the ways we're doing this within the area of services to support positive change? And most importantly, what difference is that making for children and family outcomes? So when thinking about this together, we came up with some common themes and common approaches, which you can see on the slide here, and they're from across the 5 partnerships. So number 1 is working together. We can start to understand the barriers families face in accessing services when we work together, and we can use this learning to address inequality. And that means we can make sure that no child is left behind and that we have a focus on shared pathways. Number 2, again, which was really highlighted earlier in the discussion with the directors, was around the use of data. We're really passionate and really focused on using data across the partnerships because we know it helps us to understand how data can be shared among the partners and then how we can use it to inform our service design and also tell a compelling story. More critically, we are starting to know after the 9 years of data what works and what does not. And number 3 of our common approaches is evidence-based programmes. So all the 5 areas have embedded evidence-informed and evidence-based programmes that are a good fit and acceptable for families in their local areas. And number 4 is we work in a place-based way. So there's been a real drive to bring people and organisations together locally to share information and work together to meet the unique needs of local families, achieving place-based collective impact. And number 5 is we really want to support access to the right services at the right time. The best services will only work if they are accessed by the right people at the right time. And we have definitely seen this in Blackpool, and we will share more about this shortly. And number 6 is speaking up for babies, is helping families, parents and children to share their voice. We want families to be at the centre of services, and all of the Better Start areas have a strong ethos of co-production and helping families to have a voice. We know by working together, we can develop an understanding to the barriers families face in accessing services, and we use this learning to address inequality. We can all be involved this week in speaking up for babies because, as Claire said earlier, it's the theme of this year's Infant Mental Health Awareness Week, which starts today. And if you would like to learn more about this, then you can head to some of the national sites, such as the Parent Infant Foundation, and also go to your local A Better Start partnership site, because we're all taking part in Infant Mental Health Awareness Week with lots of activities. And some of the websites will be in the chat for you. So let's think now and bring this workshop to life by thinking about one of the key themes and messages that we're passionate about in Blackpool is helping families access the right support at the right time. And we're doing this through triage panels. So we're navigating services and supporting change through a collective approach. So we're using triages to help our families in Blackpool who are pregnant or have a baby or young child to navigate through services and support positive change. We've got 2 triages that we're going to share with you today. The first being the speech, language and communication triage, and the second, the Family Hub's first 1001 days triage. The use of triages will be explored through this service lens. The triage panels are the services in this example. We're also highlighting the impact of triages for the individuals, community, workforce, and the system. So triages are quite a sophisticated and mature partnership way of working. So we are joining up services and communities. We link data with lived experience through a collective approach. So the mechanism is the triage panel, and the strength of successful triage is in the services and interventions that we signpost through to and how families then engage with these. The triage panels are the navigation tools. The panels themselves are about reach and volume, but the real meaningful impact that supports change is the family receiving the right service at the right time. So one of our pledges here in Blackpool is that our families will have the right support at the right time. But most importantly, they will, through that process, they will feel seen, heard and cared for. This is the essence of the purpose of our triages. So let me share a little bit more about them now, and then my colleague Catherine will go into it in more depth. So our first triage, the speech, language and communication, is the one that's been established the longest. It's most children aged 0 to 5 in Blackpool who need support with their speech and language communication development are referred into this triage panel. The panel meet virtually every 2 weeks. And since its inception in February 2020, the panel have discussed the speech and language communication needs of over 4,714 children. Our second panel is a newer initiative. And that went live in July last year, and that's called the Family Hub First 1001 Days Triage. So the purpose of this triage is to offer parenting programs and support families who are pregnant or have a baby or young child aged 0 to 2 and need additional support in a variety of areas, and make sure that they can get this support at the right time, in the right place, by the right people. It's a multi-agency triage and they meet face-to-face, but again, they meet like the speech and language triage every 2 weeks, but they meet together in one of our family hubs. Since its inception, this panel have discussed the care of 206 children. This includes unborn babies as well as babies and young children. 4,920. This is the collective number of babies and young children who have received support through the triages, and this has supported positive change for these families. You may be asking yourself, wow, how is this possible? What is the recipe for success? What have been the challenges? Because there's definitely been some challenges. This is what you are going to hear more about from my colleague, Catherine, now. So I will invite Catherine to the virtual stage.
Thanks, Mel. So yeah, indeed, what is the recipe for a good panel? What does a good panel look like? Well, I can talk to you about the post-Wellcome speech, language and communication panel. We've been working in this way since February 2020, and thinking about a time pre-COVID feels like a lifetime ago. And the panel's evolved a lot since then. With that in mind, what I'm going to describe to you is the kind of recipe or the formula that we've come to for the triage panel. I'm taking the learning from the last 4 years. We continue to evolve as a panel to meet the needs of children and their families and services and the system as a whole. So firstly, let's think about the system. One of the most essential components in any triage panel has to be the multi-agency representation in the group. And the speech language communication panel has representatives from 4 different agencies, all of whom use different data management systems. So it was important for us that we set up our own. And in our case, along with COVID, came Microsoft Teams. Each organisation and local authority will have their own GDPR requirements, and one of these is about data ownership. And whilst we won't cover that today, it needs to be understood that this is one of the biggest hurdles at the time. But once it's in place, it really does make a difference to children and families. And all the members of the panel have now access to a shared space on Microsoft Teams, as do their named admin support. And this doesn't replace their individual management systems, but it does mean that referral forms, welcome assessments, and contact logs can all be accessed by the panel, which of course has been allowed by consent from the parents. So even if a family is unlikely because of the level of need to have contact with the specialist services within the NHS, we still ask permission for representatives from the NHS to access the children's information, as they'll be discussed at panel. And this, amongst other things like the panel quorate, membership and governance, and having an independent chair, needs to be covered in a robust terms of reference, which we review as a panel annually. There also, crucially, needs to be a common assessment tool that's used across the different agencies. And in our case, we use the Welcome Assessment tool. Health visitors use this at 3 of the Healthy Child Development checks. So they use it at the 9 to 12 month check, 2.5-year check, and at their preschool check. And early years practitioners, including childminders, use this in settings and screen their whole preschool cohort, as well as any other children that they may have concerns about that come up through their ordinary kind of observation and assessment cycle. We've now had a few referrals from our family hubs and one from a housing department and a few from the voluntary sector, and it's our aspiration to support children and their families in this way via Welcome being part of the early help assessment. In terms of services, we've got to think about the so, what and why. So any good panel needs really good evidence-based interventions to signpost to. And this is usually arranged in a type of a flowchart diagram or like a map, but they don't translate well to PowerPoint. So imagine in your head something like Google Maps, and there are different routes that they come up with: a shorter route, a most economical route, a route avoiding tolls, a route avoiding motorways, all depending on the type of journey that you'd like to have. But actually, the beginning of the journey and the destination is the same. So we'd want to try and get from A to B. Well, in this case, our triage panel navigates both that journey for families, and it sometimes depends on where the children spends most of their week, how old they are, what their clinical needs are, and what the parents' views are. It also returns an opportunity to return to panel after intervention for next steps, a revolving door. Don't forget your return journey and how are you going to get back. So it's kind of a revolving door where children can be escalated according to their need or signpost to another service if their circumstances change. And we're also very lucky to have a universal offer of support in early years settings and in family hubs based on Speech and Language UK's early talk strategies. And we particularly focus on 6 of those in Blackpool, which we call our Blackpool Super 6. In terms of services, the membership of the panel needs to be consistent. And this is a real shout out. Most importantly, there needs to be commitment from senior leadership for attendance at the panel and protected time to prepare for them. I'm going to jump to community before I go to workforce and the individual. So thinking about community, the 2 panels we're talking about are different in terms of where and when they're held and the number of children we discuss. For example, one's held virtually and one's held face to face. Both have equal merits. And you need to decide if you're going to set one up, which is best for you. The speech and language panel held its first 2 panels face to face before COVID. And then we went virtual, and the panel have agreed that that's the best way for them to work. Although as the chair, I do need a widescreen monitor to make sure I can see the whole spreadsheet for children. We also need to recognise that each of the panels is dealing with different levels of complexity and changing information. So how, when, where, and who of the panels needs to be carefully thought out, and maybe a commitment to think about the number of children or families that can be discussed at each one. Then the workforce, a key element of the panel is a well-informed workforce on multiple layers. Firstly, in terms of panel membership, having a really good knowledge base of each other's service and what we do and what they look like so that all members can be informed and make the decisions about the children, not just those managing individual services. This takes time and energy and trust, but when it happens, it's really rewarding and shows that there's trust in each other and who would best meet the needs of the children. Additionally, no panel is good without the quality of the referrals. And we've invested in training in the wider workforce and in identification of need, completing a good quality referral and supporting children from the moment the referral is done. And we do this in a number of ways. The health visiting teams share anticipatory guidance around the Super 6 strategies. Early years practitioners begin to use the big book of ideas from Welcome to support specific areas of need. And our community connectors share speech and language information packs, which contain top tips, where to access universal support, and crucially, a storybook, because we know story sharing is the rocket fuel for supporting children's language development. And finally, but crucially, the individual. From an individual perspective, it's important to capture the voice of the family at panel. So we attempt to contact each family referred in ahead of the panel to ask them specifically about the referral and tell them the types of interventions available to them. This information is then captured and treated as importantly as the clinical information presented at the panel. And in terms of the voice of the child, we know that targeted services have the best outcomes for children when the child has a trusted relationship with the person there to help them. We therefore use a coaching model to support parents and early years practitioners who are with the child the most and who've developed those trusting relationships with the children to support the child's need the most. Thanks, Mel. So next, the opportunities for change. And I just wanted to spend some time thinking about when you've got the formula and you've got that recipe right, what that means. And what we've learned in the 4 years of doing the speech and language triage panel is when we're involving parents in the decision about the children, obviously they're then more likely to keep up with that intervention because they've really had their voice heard. So families are more likely to engage in the intervention. Children have access to the right service at the right time and in the right place, and they're not removed from where they spend most of their time to go to a clinical appointment. The whole workforce becomes familiar with each other's services and systems allowing for that crucial skills mix. And there becomes a culture of this revolving door, with families navigating through the system by the system itself, not through individual services. and shared information and resource so that families only need to tell their story once, which is really important. We've got some quotes for some families that have been through some of the services that the panels refer to. And we've got one family that shared with us that they support the speech and language panel, and the intervention that they had supported speech and language, and they're honestly so good. They turned my Luca from not really talking boy to an absolute chatterbox. And then somebody that's been through the first 1001 days triage panel said, you save lives, you save more lives than you can imagine by giving people a chance. And we've got a quote from somebody that sits as a professional on the Family Hub triage panel, who said that our services that are part of the Family Hub first 1001 days triage work closely with partners from across the Blackpool system, such as children's social care, children's services, midwives, police, mental health services, health visitors, and many others. These partners value the triage and the services for the difference it makes to families and to their work. Helping families to navigate services using triage is supporting a positive change for families, not just those, but also the system. This is captured by one service manager who has shared their thoughts about one of the services for baby's sake. And they said, for baby's sake, has been absolutely wonderful for this family, together with pre-birth assessment work and social care intervention. When they get the timing and support right, it really, really does change lives. So now what we're going to do is hand over and find some examples from the other Better Start sites. And I'm going to invite Helen, Carla, Alison and Nikki to share some case studies of their work, starting with Alison from Nottingham. Thanks, Alison.
Thanks, Catherine. Hi, everyone. I'm Alison Poxon and I'm the project manager at Small Steps, Big Changes in Nottingham. I'm going to give a brief overview of the commissioning and sustainability of speech, language and communication services across the city. So our starting point for this was a consultation with parents, and the key response from parents was that what they wanted from speech and language services was real practical support and ideas of things to do with their children to support their speech and language development in the home. So with that in mind, we commissioned a range of services. So Home Talk, which is a home visiting service for 2 to 2.5-year-olds. Tiny Steps to Talking Groups, which is group provision for families who have babies who are 9 months plus. Talking Tots and Babies programme, group provision again, and that's for preschool children. We also run drop-in sessions with a speech and language therapist where ideas are given alongside a referral to specialist services if needed. We also commission literacy champions who are volunteers who do a number of speech and language activities in their local areas. So we have, for example, one literacy champion who gives books to local food banks so families can take books away with their food orders. We also commission the Dolly Parton Imagination Library scheme, where free books for under fives are delivered to the family home every month. And then we've been working with another couple of areas to develop idea sheets for parents to use with the Dolly Parton books so they can do activities with their children, which are linked to the books. And then in addition to all of those services, we also commission workforce training for all practitioners, so they're also able to share hints and tips with parents for speech and language development. So with the community lottery funding ending in March 25, so next March, we've been working with commissioners locally to explore commissioning opportunities, not just across the city, but also across the county too, so Nottinghamshire as well. And in the last 12 months, we've been supported in these partnership conversations with an academic partner at Nottingham Trent University, who've been working with us to identify what are our priorities for speech and language service delivery, what are the gaps in services for families, and opportunities for joint commissioning. So specifically then, we're working in partnership, working with our academic partner to support us in these conversations, to develop advice lines for parents and practitioners to call when there are speech and language concerns, a single point of contact across the city and county for speech and language referrals where they can be triaged, an integrated pathway for services at universal specialist and targeted levels, and joint training for staff. So we're speaking to senior colleagues to explore these future commissioning opportunities across all these areas of work using a robust evidence base and data that we've collected across all of our commission services. It's not an easy process, to be honest, as commissioners absolutely understandably don't have the access to the levels of funding that we've been privileged to have across all of our ABS services over the last 10 years. But we're hopeful that through ongoing conversations and also remodelling of current services to move them towards a more acceptable financial envelope, we're hopeful that provision will continue for families in Nottingham. So identifying future funding is difficult, but I'm going to end with one of hundreds of quotes we've got to hand to remind us why we are pressing for funding from our partnerships. And this is a quote from a parent who received support from the Home Talk survey. So that's the home visiting service that we commission. I was feeling very down about how my child was when talking when the Home Talk workers started to visit us. She gave us lots of ideas for what to do with our son and helped us understand how much he learns just by playing. Since we've had this support, I can see how much my son is talking and understanding better, and I can't thank you enough for all of this help and the confidence it's given me to be a better parent. On that note, I would like to pass on to Carla.
Thank you, Alison, and good afternoon, everyone. My name is Carla Stenke, and I'm the Public Health Specialist for LEAP. Today, I'm going to talk about LEAP's approach to using data to support service improvement and learning. We've talked about data, you've heard it mentioned several times today, and all 5 Better Start sites collect a lot of data, and we all consider how best to use this data to help us achieve our outcomes and tell our stories. In complex environments, continuous learning drives improvement. Best practice for evaluating complex, place-based, and collective impact initiatives requires learning to be ongoing rather than only measuring impact. To support this, LEAP developed a suite of evaluation and learning tools to help embed learning across the program. At the service level, we developed something called quarterly service reports. Quarterly service reports summarize user and engagement data through an equalities lens and provide feedback to services to enable them to adapt and improve their service delivery and engagement with priority groups of people. Quarterly service reports identify the extent to which services are achieving or working towards achieving their medium-term and high-level long-term outcomes. And they also identify any potential barriers or challenges to achieving these outcomes. We review quarterly service reports with service leads regularly, and they have proven to be really useful tools for helping us to monitor delivery across the program. At the program level, we develop something called annual learning reports. Our annual learning reports assess the extent to which LEAP is reaching and engaging its priority population. And they also summarize our progress towards achieving our long-term outcomes. Our learning continues at pace with a whole suite of research and learning projects in place designed to capture insights about our services and about our program as a collective. We communicate key findings and progress towards achieving our long-term outcomes with external stakeholders, exactly like we're doing here today. Thanks very much for being here, and I will now hand over to Helen.
Hi everybody, and thank you, Carla. So I'm Helen. I'm the early years specialist at Better Start Bradford. On the slide, a picture you can see is when Andrea Ledson actually visited one of the family hubs and one of the projects from the Start for Life earlier on this year. And I'll talk a bit more about what the mum has actually said. But I mean, the brief bit you can see is obviously really positive feedback. So when I was asked to talk about services, I thought a lot about the whole portfolio of projects that are actually supported, commissioned and delivered by Better Start Bradford. Which one would be the best to illustrate the change and influence that we've had here in Bradford? As with all the other sites, we could use any of the projects to actually show the successes. So instead, I wanted to talk about how Better Start Bradford and how ABS generally is even bigger than each project, and how the learning from the whole programme will continue to provide a legacy for change within the district, within the 5 sites, and across the country. So Bradford is one of the initial 75 local authorities who receive the money from Start for Life and within the Family Hubs programme. If you're not familiar with the Start for Life programme, it's a joint programme commissioned by the DFE, so the Department of Education, and the Department for Health and Social Care. And following on from the report that was done from Andrea Ledson, hence the picture earlier on about 1001 Critical Days, the aim of that project, or that programme, was to actually ensure that services were joined up and families were able to access the support they needed at the right time in the right place. The fundamental strands for the Start for Life programme could have almost been lifted from the Better Start Bradford programme. We're already delivering services focusing on the home learning environment, on infant feeding, on infant and perinatal mental health. So existing models for partnership and relationship and the integrated working enabled 6 of our projects to be lifted and moved straight into the actual Start for Life portfolio. The sharing of the learning, though, didn't stop at those 6 projects. We were able to ensure that the co-production, the place-based delivery, the evidence-based projects, the data collection, has been mentioned already by Melanie and the rest of the team, were able to be woven into the whole of the Start for Life programme. The future of the Start for Life, like ABS, is unfortunately uncertain. But we do know that the ABS whole partnership will continue to embed its legacy into the learning and basically the services that have been offered to the growing needs, or to meet the growing needs of baby, children and families in the future. So I want to finish with the words of the mum in the picture, who benefited from just one of our projects that was actually initially commissioned by Better Start Bradford and moved on to Start for Life. It was when my little boy was 8 weeks old, and after the usual baby checks from the health visitor who asked how I was doing, it all came out. I was struggling. The health visitor referred me to Little Minds Matter. It's unbelievable how much I've changed, how much I've learned to engage with my baby, and how much I've learned to process how I was feeling as a new mum. Each of the ABS sites and each of the projects have many stories like this to tell. And it's those differences that will ensure that the messages of ABS and the subsequent work will continue to shape the future of the early years in this country. So on that, thank you for listening. I'm just going to pass you over to Nikki in Southend.
Thanks, Helen. Hello, everyone. For my part today, I wanted to put the spotlight on one particular service, which is our early years domestic abuse service. And this, we believe, truly embodies the ambition of the Better Start through its early intervention, unique approach, and how it's really centred on key areas to help create the change. At a Better Start, we recognise the importance of helping parents understand how their choices affect their children. By building their confidence, we empower parents to make better decisions for themselves and regarding their children's needs, creating safer and more nurturing environments. But first, some context. Southend has the highest rate of domestic abuse in Essex, and this has been the case for 8 consecutive years. And as the slide shows, in just 1 year, a high number of children under 5 have been potential victims of abuse. Research shows us that in 90% of domestic abuse incidents, children are in the same or an adjacent room when the abuse occurs. And it is now recognised that children are not passive witnesses to domestic abuse, but are in fact considered victims. In response to this evidence and the local data, an early years initiative targeted at younger children has been created in partnership with Safe Steps, who are an already established domestic abuse service, previously known as Women's Aid. And this service has been designed to break down barriers, connect services to people, and give babies and young children a voice. So how are we doing things differently? Well, we focused on 3 key areas. Firstly, to offer timely and easier access to the right support, and 2 trained specialists conduct risk assessments, provide safety and emotional support. And a carefully designed referral pathway provides multiple routes into the service. Uniquely, the early years IDVAs are co-located within the family centres in Southend. And this co-location provides greater opportunities for parental disclosure, ensuring that the right professionals are available at the right time through a joined-up approach. The second focus has been educating parents on the effects of the abuse on their children. Raising awareness really helps parents understand the profound and lasting impacts on development and emotional well-being. And this has been achieved through a face-to-face recovery programme. And thinking about how we can support parents, we offer a creche service running alongside. This has been made possible in collaboration with our partners from City Family. And the creche service not only allows for parents to fully engage, but also gives children who may have lacked socialisation opportunities a chance to interact in a safe environment. And finally, a training programme has been created aimed at and being offered to all the early years workforce in Southend. It's focused on being able to spot the signs of abuse and raising awareness of abuse on children and its long-lasting impact. This ensuring an increased capacity for identifying abuse and signposting families to the right help quickly. Thanks for listening, and I'm going to pass you back to Melanie.
Thank you, Nikki, and thank you to the others for sharing that example. So we began this session by speaking about the Better Start partnerships and how we're doing things differently, but that we have common elements and approaches. Our examples have hopefully brought to life what we are doing, but most importantly, how we're doing it. Our recipe for supporting change through the services is clear to follow. Over the last 9 years, we've tried and tested the ingredients. We know what works, and we all work together, focusing on breaking down barriers. We all connect services and people. We all use data to drive and inform improvement, and we all use evidence-informed, evidence-based programs that are fit for a good fit for our families. We know the importance of being place-based. We all have infrastructures in place that support families to navigate the services available so they can access the right support at the right time by the right people. And most importantly, we all speak up for babies. So we would like you to call you to action today. We'd like you to take action by being brave, do things differently, but together. Use the Better Start recipe so that then you will see positive change for yourselves and your families in your areas, and you will be supporting babies in your areas to have a better start. If we can do it, you can do it too. So I'm going to invite my colleague Catherine now to lead on our question and answer session, and I will stop sharing my screen so we can do that. Thank you.
Thanks, Mel. So yeah, I'd ask anybody that's got any questions to pop them in the chat. I've got eyes on the chat, so any questions for any of the panel, that would be great. I've got some questions to start us off. So I've got a question that's been posed to you, Alison, if that's okay. So the question is, which speech language communication service provision works best for families and their children, and why?
Ooh, great question. I would say through our kind of test and learn across the range of services, which I talked about earlier, I would say it's the group provision that's worked the best. And what families tell us is that they really welcome the opportunity to be with other parents that are going through the same issues as them. So it can feel quite isolating, I think, when you can see that your child's got speech and language issues, and it can often feel like it's just you. But getting together in a group with other parents and carers that are going through the same is really kind of helpful. All the practical tips that come from a group, from the facilitator, of course, but also from other parents that have tried this and tried that and sharing ideas, which is really helpful. I think also something else that's come through our evaluation is this, something around stigma, and actually going to a family hub or a local community provision and going to a group carries less stigma, parents tell us, than perhaps having somebody coming to your family home. So I think that's another reasons why the group is so effective. And also the practical side of, you can take your babies and children with you to that group. So you don't have to get a crash, leave your baby with anybody else. So there's a kind of practical side to that. And also, I guess, you've got a baby or a child to kind of try your ideas out on straight away. So there's a kind of practical sense of having a willing kind of volunteer to trial out some of the ideas you're hearing from the group. So lots of different reasons. It's notwithstanding families that much prefer to have that visit to the family home. But I would say, in answer to the question, that it's been our group provision that's been particularly successful.
Brilliant. Thanks, Alison. So we've got the right time and the right place there. The time sort of being where they can practice what they're being suggested there, in the right place, but also by the right person. That peer support really came through strongly there. Yeah, brilliant. Thank you very much. We've got time for a few more questions, so please pop them in the chat. We have a question for Nikki, if that's okay. So Nikki, what's been the feedback from parents and practitioners about the service?
Thanks, Catherine. So our evaluations have been really, really positive for this service, and we know that parents that have attended the recovery toolkit, which I spoke about earlier, 100% of those parents have told us that they are more able to recognise what abusive behaviours look like, and also that they're telling us that they understand the impact of that abuse on children, which is absolutely fantastic. And equally from our practitioners and our community groups and other professionals that we're working with, again, 100% of those professionals have come away from those meetings saying that they really have greater knowledge and understanding of how to respond to families. But for me, the most interesting part is that 84% of those professionals and practitioners and community groups that we've talked to said that they've got increased confidence to be able to discuss domestic abuse with those parents. So put that together with parents also having raised level of confidence, that's just a wonderful thing. And the evaluations have been just so positive in that.
That's brilliant. Thanks, Nikki. So yeah, that practitioner confidence is really, really important, isn't it? And I think, I'm not too sure about you, but I think that COVID has got a lot to sort of take responsibility for, that whole thing where we removed ourselves professionally and there was this kind of like barrier of space and time between practitioners and families. And I feel like it's taken quite a long time to build that confidence up, whether that's from, you know, an early years practitioner having a conversation about a speech and language referral that's necessary, or you know, in your field of work. I just think that that sort of confidence is something that it's not to be underestimated, I think, and how COVID has had an impact on that. So thanks for that. We've probably got time for one more. So Helen, I've got a question here for you around your work around the overlap, if you like, from Better Start to Start for Life. But there is some concern in this question really around the fact that the timing of the funding ends at the same time. So how do you think that might affect the longer term picture? And also it's kind of linked to a question that's come through the chat around how are we going to make sure that this work is maintained beyond the funding, especially when services and funding is stretched.
Hi, well, thank you for that. I think there's a few ways really. I mean, we're in such a difficult time at the moment that we've no idea realistically what's going to be happening by April next year. We're quite lucky in Bradford that we've already managed to secure an extension for a further 6 months, that within Bradford that fits in with, it's the Bradford City of Culture that year as well, so that ties in with that. But as far as the flexibility really of the Better Start programme, I think the work with Start for Life has been so positive to see. Like I mentioned, it wasn't just the 6 projects. It was the learning that we took that we were able to be much more flexible and move on. So things like the Incredible Years programme, we were offering Incredible Years within Better Start for a 2 to 3 year old or toddler type provision. We know it really worked, but the Start for Life was basically wanting a preschool provision. So we're able to adapt it and actually look at another intervention that was there that we knew would actually work with the community that we've got here in Bradford because of the actual evidence that we've already gathered. Another thing was the Owlets programme. We deliver Talking Together, which is a home visiting programme, very similar to what Alison was speaking about, but it didn't fit in with the Start for Life session as such. But we were able to use the learning again and basically use some money from public health to commission a group-based intervention, again, just fitting in with the needs of the community. So it showed that we can actually take interventions and adapt them because of the learning we've got from Better Start. So I think that's just really positive.